Welcome to the University of Michigan Dentistry podcast series, promoting oral health care worldwide.
Successful overdenture care does not end with the placement of the prosthesis. The finest prosthetic service can be doomed to failure if post-insertion care is neglected. The result of poor follow-up can be a profound limitation to mastication, deglutition, speech, aesthetics, and the loss of goodwill of the patient. Underlying reasons for the success or failure of overdenture treatment are really no different than for other dental therapy. Recurrence of dental caries and exacerbation of periodontal disease are the most serious considerations. Central to the maintenance of a restoration and its long-term prognosis is the patient's commitment to a strict oral hygiene regimen. A program for overdenture maintenance should include abutment tooth care, denture care, a regular program of professional recall. A wide variety of oral hygiene aids exist for overdenture abutment care by the patient. A partial grouping of such aids might include 1. A soft multi-tuft nylon toothbrush. 2. A modified soft toothbrush or an adult end-tuft brush. 3. A length of 4-ply, 4-ounce nylon yarn or a length of 1-inch gauze roller bandage. There are several types of so-called super dental floss available currently, and they can be used in place of either of the preceding items. 4. A portable rubber cup prophylaxis unit. 5. Any of a variety of soft wooden toothpicks or sulcus brushes. 6. Topical fluoride, for example, Fluoriguard mouthwash, acidulated phosphate fluoride gel, 0.4% stannous fluoride, or sodium fluoride. A soft, multi-tuft nylon toothbrush can be used to maintain excellent abutment health, while it also cleanses and stimulates associated periodontal structures and basal seat tissues. A small circular scrub motion is initiated after the bristles have been gently inserted into the gingival crevice at the appropriate angle. The brush can be manipulated in such a way as to facilitate access between abutments or in hard-to-reach areas. A modified sulcus brush or an end-tuft brush can be similarly used to achieve excellent results in the disruption of dental plaque. By using roller gauze, common yarn, or superfloss in a sawing or shoe shine fashion, excellent results can be achieved in cleansing the crevicular area of the overdenture abutment. Care should be used to proceed in a gentle yet thorough manner, taking time to cleanse the tooth circumferentially. Used in conjunction with a toothbrush, this aid can help the patient realize zero plaque growth. For the geriatric patient with limited vision or motor control, or for a handicapped individual similarly debilitated, the use of a portable electric brush or prophylaxis cup may be advantageous. When time or facilities are not available for thorough cleansing, toothpicks, soft wooden wedges, or any of a number of sulcus cleaning aids can be utilized for overdenture abutment care. These aids are generally considered to be auxiliary to those previously noted, however, and are difficult to use in a thorough manner. A useful adjunct to mechanical cleansing of the overdenture abutment is the application of a topical fluoride to reduce the risk of caries. Even in the presence of teeth with copings, the risk of cervical caries is high due to the manner in which an overdenture can trap cariogenic agents against the tooth. The overdenture can act as a convenient tray for fluoride application, however, and the utilization of a commercially available fluoride gel against the cleaned abutments is encouraged. Of equal importance to abutment tooth care is the maintenance of prosthesis cleanliness. Such care should be considered with that of any dental prosthesis and be clearly defined for the patient. A typical denture care package should include written instructions detailing the importance of prosthetic care and clarifying the patient's role at home. While discussing patient concerns and expectations, these will hopefully have been discussed prior to completion of treatment. One of an assortment of denture brushes. The use of the brush should be thoroughly demonstrated to the patient. It is wise to suggest measures for protecting the prosthesis against breakage during brushing. A towel or water in the sink will cushion the fall should the denture be dropped, and the patient should be shown how to properly hold the prosthesis. The use of an apothecary soaking agent is permissible, although it does not replace the importance of thorough brushing. In the presence of chrome-based alloys, one should use caution with chlorine-based soaking agents and watch for pitting or corrosion. A peroxide-based soak is an appropriate substitute in such circumstances. With the increased complexity of overdenture attachments, the patient should be carefully instructed in the proper manner of appliance insertion and removal. A frantic call about a broken appliance or lost attachment can often be avoided if the patient fully understands the prosthesis and its function. Along with good home care, regular professional recall is a vital part of overdenture success. Periodic recall, the interval of which is determined by patient factors, diet history, caries rate, and prevalence of disease, should include 1. Panoramic radiographic survey every 3 years, periapical radiographic examination yearly. 2. Prophylaxis and reinforcement of oral hygiene procedures. 3. Careful examination of abutment integrity, looking for marginal leakage, caries, and evidence of wear. 4. Evaluation of basal seat adaptation and uniformity of abutment load. Assess retention and stability with the need for relining in mind. 5. Refinement of occlusal contacts with careful attention to occlusal vertical dimension and signs of occlusal wear. If necessary, reschedule the patient for a remount procedure. And 6. A general questioning of the patient with regard to comfort and concerns. Before treatment, many patients in need of overdenture therapy present with advanced periodontal disease and caries. Often, effective home care is impossible, and the patient appears to have little concern for his oral health. When there is a true lack of concern, overdenture therapy is not indicated. But the patient who expresses a sincere desire to salvage his dentition can possibly have oral disease controlled. With the application of sound overdenture concepts, oral health can be restored and maintenance simplified. The patient will often express a renewed interest in oral health factors. Of course, restoration is through the efforts of a team, of which the dentist is only one member. The patient must be educated to understand that he has the major responsibility for control of oral disease.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.